welcome back to our Health and Science Focus this morning. And today we're talking about bipolar disorder. Did you know that more than 4 million South Africans are living with bipolar disorder? Well, I'm joined now by Sanam Naran from Houghton House. She's been at the forefront in treating people with bipolar and other related mental illnesses. She is a psychologist. Sanam, a very good morning, and thanks so much for your time this morning. And such an important topic that we have to talk about this as we see more and more people being diagnosed with bipolar disorder in this country. Where do you fit into the treatment picture as a psychologist?
Thank you, Vika. It's such a privilege to be speaking on bipolar. I think a lot of the emphasis is placed on seeing a general practitioner or a psychiatrist if someone suspects that they have bipolar disorder. And not many people think of, seeing a psychologist. And I think that's really important in the treatment process and the treatment plan in order to get a more holistic kind of form of treatment for somebody. As the psychiatrist had mentioned, their role is more around medication and the pharmacological aspects of treating bipolar disorder. But for psychologists like myself, we focus more on talk therapy and psychotherapy and helping or assisting the patient to kind of deal with their disorder or their diagnosis and how they can sort of make their life more manageable and get a better quality of life out of their diagnosis.
So in your sessions with patients who are living with bipolar disorder, do they understand what is happening with them? Do they understand? Because from what we heard from Dr. Janet earlier, it's a whole lot of stuff that just kind of whacks you in one go, it seems. And it's almost things that you can't see coming, which is also very, very worrying. And I'm sure scary for many patients as well.
Definitely. So the first step when a patient comes to me suspecting that they may have bipolar disorder, what I would do is kind of help them accept their diagnosis because, like you said, it's a very scary thing. For some people, it's so scary, they're not really sure, how to deal with it. What does this mean for them? But for others, it could come as a relief. So they may, find comfort in knowing that, okay, this is bipolar disorder and now I can treat it. So the first step for me is to sort of help them kind of accept this diagnosis. What does bipolar disorder mean? What can they expect out of this disorder? And also to help to psychoeducate the family around what is bipolar disorder. How can they support their loved ones in a better way? So educating the patient or the client on what bipolar disorder is extremely important so they know exactly what to expect.
I mean, there are lots of cultural issues that surround this. It's taboo in many cultures to talk about this. I mean, when we talk about the 4 million or more that are living with bipolar, those are the ones we know of. Those are the ones who've gone out and gotten help so that we can record it. If we look at those who live in far-flung areas, or who may not ever, who may go through life not knowing that this is what they have, they may be labeled crazy. Unfortunately, those are the labels we put on them. How do we get through those, or do you see that in your treatment of patients as well, that there's a lot of cultural taboo, lots of cultural sort of hang-ups when it comes to dealing with an illness, a mental illness like this?
So I think this is such an important topic because the stigma and the stigma around mental illness is quite rife, especially in South Africa. And I think that's why having awareness and allowing us to speak about bipolar disorder like this is really important to educate people on what exactly it is. The stats say that there's 3 to 4% of people that are diagnosed with bipolar disorder in South Africa, but only 1% actually go and get the help. And I think it's also important to note that 30% of those who are diagnosed with bipolar disorder attempt suicide in their life. So breaking the stigma and getting help and seeking support is so important when it comes to mental illness. And yes, I do see a ton of patients who struggle with the stigma around not only bipolar disorder, but other mental illnesses. And like you said, in a lot of cultures, it's labeled as dangerous, unstable, crazy. And nobody wants to then go out and get the help because of these labels. They rather kind of sit in silence and deal with it alone, when that is so detrimental on their mental health. So I think that speaking about this more often and bringing awareness to what bipolar disorder is so important, because the stigma in South Africa in specific cultural groups are quite high.
Sanam, in your sessions with your patients, is the entire family required, if the person has a family, is the entire family required to be part of those? I mean, could they also sometimes pose a danger to others? And surely this could be quite destructive for the entire family structure if everybody's not on board.
So, what I would do is I would start working with the patient on an individual basis, and kind of help them through their journey, but as well as include the family. So I think that's extremely important, to include the family or the loved ones, so that they know what to expect, so that they're able to better support the person diagnosed with bipolar disorder. So psychoeducation to the family is really important, because sometimes the family can aggravate the symptoms, but they can also play a huge role in kind of lessening the severity of the symptoms.
Is it a change of lifestyle for everyone then, not just the patient, not just the person living with bipolar disorder? Does this require basically a change for everyone from this moment on?
Definitely. And I think that goes with a lot of mental illnesses. There has to be a huge change in terms of the family dynamics, in terms of day-to-day kind of routines and structures that are put in place. I think that everybody needs to go through a change. And I think that's what makes it so difficult, is because, people don't really like change. But it is something that's quite relevant.
And do you see any particular types of personalities, Sanam, who are more susceptible to bipolar disorder? Can we pinpoint that, it is this A type or B type or whatever it is, or somebody who is in this field, maybe where things are particularly more stressful? Can we narrow it down like that?
No, I don't think we can do that. We will often try and search for answers when it comes to, what is the causes of bipolar disorder. But no, I wouldn't say that there's a specific personality type that's more susceptible to bipolar. I think it goes with, genetics, with the biochemical structure, maybe, past traumas, environmental factors, and all of that kind of play a role. Research does suggest that 15 to 30% of the onset of bipolar is caused by genetics. But also things like substance abuse, which I see daily, can kind of trigger an onset of bipolar disorder.
So, with the right kind of treatment, though, with the right kind of support, have you seen patients go on to live normal, happy, healthy lives, having families of their own, carrying on, just to give others hope out there that this is possible to carry on, that this is not something that says, this is where life stops for you because you have to manage this thing?
Definitely. Bipolar disorder is obviously not curable, but it is extremely manageable. And I think, what's important is the first point of call is to go to your GP, get that diagnosed, then visit a psychiatrist to get it medically sorted out, and then visit a psychologist to kind of help you to manage this illness better and to make your quality of life as a normal person. So I definitely think.
Sanam, you spoke about going to a GP. How does a GP diagnose this? I understand going to someone like you or going to a psychiatrist, that they would take you through a series of tests. Can a GP diagnose something like this?
So what happens is usually when people are experiencing symptoms, they would often go to their GP as the first point of call. They wouldn't necessarily think of going to a psychiatrist. So what the GP will do is say, okay, you meet this criteria. I'm going to now refer you to a psychiatrist to get a second opinion or to diagnose this properly. So that's what usually happens.
All right. So just a final word from you, Sanam, then for anybody who suspects or somebody who's just found out or somebody who feels, you know, they've been living with this for years, but they're having a bit of a tough time, especially after COVID as well. I'm sure that we've seen a lot of people who've battled in this time. Just some words of hope, I think, is what people need, because like we say, this is not something you can cure. You have to live with it and you have to manage it.
So just like, you know, any other illness, I think that bipolar disorder is so manageable if you do get the right treatment. And I just want to say that, you know, in South Africa, it's really difficult, especially underprivileged communities, to go to a psychiatrist, to go to a psychologist. But to remember that there are local clinics who have these health professionals there. There are psychologists who do pro bono sessions every year. There are government hospitals and a lot of support groups for people living with bipolar disorder. So there is a lot of help and support out there. And, you know, it's very possible to live an extremely normal life whilst being diagnosed with bipolar disorder.
Okay, Sanam Naran, thank you so much for that. Also part of the treatment, psychologists also form part of that, even though there is medical intervention as well when it comes to dealing with bipolar disorder. And like you heard her say, you can go on to live happy, healthy lives. We'll tell you just how, or one woman will tell us how she did that. We're going to be talking to Refilwe Dipolo. She's a mother and living with bipolar disorder, and her daughter is here as well to talk to us about how they all rally together to help each other through this. That's coming up.